Nope, hang on. Share this window.
Yes, that works.
Oh, that's so much better.
There?
Yes. Perfect.
Right. So, infant, neonate 1 month, 1 day to 1 month, infants 1 year. Beyond that, we're going to get into the differences, but largely big heads, not very developed, no way of really assessing mentality other than through vitals and things. Their respiratory rate's about 25 to 55. Heart rate should be above 100 always. It's usually about 120 to about 140, depending on exertion, crying, if they're sleeping or not. And their respiratory rate, their drive is very haywire. It's not, there's no regular rhythm to it. That usually levels off at about a year, maybe even a little bit beyond a year. You start to get irregular rate for them. Okay. So we need to figure out when we're looking at these kids, and again, 6 to 8 pounds, 6 to 8 pounds is normal. The head is huge. It uses up a lot of calories to work. It's oversized and it's difficult to deliver. And that's why we deliver infants at a premature age. Okay. So we grow very, very rapidly. That's why they're eating and sleeping basically. What did that say? Triples at the end of the first year. So their size triples by the end. Okay. Obligate nasal breathers so that they can eat and breastfeed and breathe. And the nervous system begins to develop once they're out in the world, something called proprioception, knowing their location in the area and how to manipulate the world around them in order to move, scoot through the world. So there's something called the Moro reflex, and that's when you open the arms wide and spread the fingers, and it grabs at things. So neonate will, if you make a sound, they reach out and grab. And everyone says, well, because if we were in trees or if there was a mother there, the baby is grabbing at the mother or the thing that's going to hold on, that it will hold on to. Same kind of thing. The palmar grasp is if you rub the palm of their hand, of an infant's hand, it will grasp onto whatever it is, a finger, a stick. There's a really cool image of a surgeon doing cardiac surgery on an infant, a fetus still in the womb. And the surgeon's gloved finger is down at near where the laceration or the incision is, and there's a little fetus hand grasping the infant, the doctor's palmed gloved finger. It's really wild. I'll see if I can find it at break. So we have, and we call these reflexes. In other animals, we would call it an instinct. I don't know why we don't think that we're animals, but think of a reflex in this case as an instinctual neurologic response. So we have the palmar grasp, the palmar reflex, the Moro reflex, which is to grab for something more, the rooting reflex, which is the instinctive ability of the head and the body to kind of root around looking for the nipple. So they start to kind of like inchworm around with their face and head. Once you put the baby on the mother's stomach or chest, you'll see them looking around for the breast. And then the last one, which is absolutely necessary, is the sucking reflex. You would have to imagine what the neurologic intricacy is of you learning how to use a straw or to suckle. You have to know how to close your mouth around something tightly and then move your tongue and kind of create a negative energy, negative atmosphere in your mouth by sucking in hopes that whatever is you're sucking on is going to release some kind of fluid or air. And so that's a very complex neurologic system already in place once we deliver. We don't have to learn that. And of course, that's why we still exist, as the babies that come out need to be able to suck so that they can live. So this big giant head is difficult to deliver. And so we have these unfused joints in our head. All of these different, anytime you have two different spots of bones next to one another, that's called a joint. They're usually immobile, but in this case, when you deliver, the head joints have not fused together. So you can get a situation where they will overlap and kind of concave around each other, shrinking the head and moving it, making it malleable enough to deliver out through the birth canal. Once it's out, within a few days, usually, everything will pop back into place, except there are two soft spots called fontanelles on the baby's head that we worry about. One of them is at the very top of the coronal, at the top, the anterior fontanelle, and then one of them is the posterior fontanelle at the occiput and the parietal bones. So in this case, how do I get my little, oops. I know there's a way to pull my thing out. So the parietal bone is the two upper right and left sides. In the very front of that baby's head, you have the frontal bones, the upper frontal left and right. The very backbone of the skull is called the occiput. Those are all there. Those bones are good, or those soft spots are good indicators of hydration and any injury to the head. We'll get back to that. This is where everything has to pass through the body, and you can see it's a very small opening. In the very front there, where the two hips come together at the symphysis pubis, or the pubic arch, that is ligamentum. That's soft tissue, connective tissue that will loosen up towards the end of the third trimester. And it will be able to flex much more and allow not just for the baby's head to flex and move through the birth canal, but for the hips themselves to flex and torque so they can deliver more easily. About 2 months of age, babies will be able to track probably at about 10 to 15 feet away, at least, with their eyes and recognize familiar faces. Usually, early developed children will start to mirror people's faces. If people are smiling, they will mimic the smile. They may not be getting the serotonin from it, but they start to mirror those around them. So it's very important at this time for them to see people and to get stimulus, vocal and visual, because they begin to form this whole Rolodex of stimuli and information of the senses. Likewise, as they're getting this neurologic stimuli, they're also responding and moving with the world around them. And so at about 6 months of age, they have developed enough musculature to lift their head up so that they're no longer, if they're face down, they can pull their head off of the mattress. They can sit up, which is a huge step. They can roll over, and they begin to start making verbal sounds. Not really making sense, although I will show you a quick video of a woman that thinks that we can understand a lot more of a baby's crying than we recognize. I do believe that, but in her case, she's saying they're saying specific things. I don't know if that's the case. In any case, so while they're learning and they're thinking more and they're mimicking more, they're also moving through the world and developing their sense of balance and coordination. At about 12 months of age, they are usually up and walking, reaching out, but you can see them using their core to balance and walk through the world. This is after they've kind of crawled. Some babies don't crawl. Some babies just go from laying down to trying to stand and fall and fall and fall, and eventually learn how to just go walking, which then turns to running, and it's crazy. From there on out, you need to make sure everything is child-proofed. As I mentioned before, the mother's immune system is going to be taking care of the baby up until about a year. So we should figure out, like, if the child is crying and if the baby is not crying and sleeping when there's people around, is that a good sign or a bad sign? So we have some psychosocial changes that we should be looking for. Usually up until about 8 months, there is no stranger anxiety. An infant up until about 8 or 9 months, when they begin to recognize regular people, mom and dad, grandma, grandpa, friends, neighbors, if you're not one of those faces they recognize, they will begin to have an anxiety attack. They'll have stranger danger. They start to cry if they see you. That's a good sign. As a caregiver, if we walk into a house and the child at 8 or 9 months sees us and then eyes widen and they start crying and reaching for their parent, that's a very good sign. It means they're neurologically sound. They are obviously getting enough oxygen and their blood is circulating stably so that they are able to understand some big weird strangers just walked through the door, and they have come with all their stranger buddies, and they have all these bags and they're stomping around in the house. When you should be concerned is if you walk in and the infant or the infant looks at you, the eyes are kind of half open and they just watch you walk in and sit down. That's not a good sign. So as sad as it is to hear an infant cry, we do want it. We want that kind of reaction initially, and then we can warm up to them. And that's kind of a technique that you'll learn as we go forward. Okay. So let's see. Yeah, so good. Now we'll move up from there to about a year. And after the year, you start to see they can walk, they start to speak. If they have other siblings, they will develop usually much faster. And they go from being an infant to a toddler. A toddler is 1 to 3 years old. After that is a preschooler, 4 to 6 years old, and because they are now going to preschool or starting kindergarten. And it's not a dramatically, the cardiovascular system of a toddler more or less is the same thing. It's just different level. It's just different vital rates and rhythms. But we're starting to develop, and your body has now taken to the circulatory system that started after you began to take breaths and all of that stuff. It's pretty wild what actually happens. The artery that comes into your belly button that used to give you oxygenated blood and nutrients becomes a ligament. It basically kind of scars over and closes, and it runs through the liver, and it kind of holds the rest of your digestive tract together. It can be a bad situation and some traumas because that thing can act like a knife or like a cheese cutter, like a big wire that can slice through your digestive tissue. If, let's say, you're traveling in a car at 160 miles an hour and you suddenly hit a wall, that little old artery that's now this razor thin ligament can slice some of your tissues. I don't know why I'm getting all the way back over to that, but just keep in mind that now that cardiovascular system that used to work for you from the beginning of your life has now kind of ended. All of those things have calcified or become vestigial, and the rest of your body is now developing as you will be as you get older as an adult. So blood pressures, usually around 80 to 100 for 3 to 6 years old, a pulse of about 80 to 40. Respiratory rates begin to drop to 20 to 25. So what you'll see is that as you get older, your heart rate decreases, your blood pressure increases, and your respiratory rate decreases and becomes more regular. So as we get older, and if you think about it, your heart is getting stronger. So each beat can move more blood. Because of that, you don't have to beat your heart as fast as it did before. So the heartbeat slows down, but you get larger. There's more tissue. The blood has to travel through more of you and go higher and higher each time you grow. The pressure in the blood vessels has to increase in order to compensate for that. And then as you breathe, your lungs are getting larger. You can also take in more air and everything. And also the muscles around your lungs become more strong and allow you to open up and get more air and really ventilate appropriately. So when you're looking at preschoolers or toddlers, that has not yet happened. There's really not enough lung muscle tissue or costal muscles. Those are all the little, that's if you ever eat ribs, the costals are the muscles surrounding the ribs. And those aren't developed really until about adolescence, or at least late, at least till about 7 or 8 years old, somewhere around there, you start to really develop into your chest and your accessory muscles. But really, it's after puberty that you see the big change. Up until that point, you predominantly breathe through your diaphragm. And if you don't have the ability to do that, you will see kids have significant issues breathing. So when you're watching kids breathe and they're having difficulties, sometimes you'll see their chest will suck in because it's literally the muscles are so weak they will flex inward when they're trying to take a breath. That's called retractions. Sometimes their bellies will stick out and they use their bellies to compensate and belly breathe. So they'll throw their bellies out, and that in turn will pull extra air into the lungs. We'll show some videos of this so that you get a better idea of it. But I bet you have seen it and you knew it looked bad. You just didn't know what exactly was going on. And you're going to see this. A lot of these kids now are starting to congregate with other buddies, and they're getting all of their infections. All these kids have snotty noses. They're running over to each other and wrestling, and they're blowing their nose on each other's sleeves. It's a nightmare. And, that's where we put them in preschool and kindergarten, and all the kids do that. And so you have the situation where they've now weaned off of breast milk and their mother's immune system, and now have to start building up their own, and even before that's happened, they're being exposed to myriad diseases and illnesses. And there's a really steep learning or growing curve in that situation. So a lot of illnesses and things occur in preschoolers and toddlers, and then eventually it kind of tapers off. That they consider that evolutionarily necessary. And there's a big counterculture now that says the fact that we're using antibiotics and we have antivirals is why so many kids are chronically ill. We're not allowing the body's own immune system to fortify and to learn not just how to defend off that disease, but learn how to build immunities to diseases. You have to learn that skill along with just not the particular illness, but how to do it for all illnesses. And so I don't know if you've noticed, but there's a real reluctance now to give out antibiotics to people unless it's absolutely necessary. And the thought is you need to let your body try and fend it off. And then the other thing is we don't want to create antibiotic immune bacteria or what do you call it? Yes. At least if not immune to it, then resistant to it. So eventually your body begins to fend for itself. They're using the toilet at about 28 months, so somewhere around 2 years, some are earlier than that, but you will be able to taper off of diapers and get them to, it's kind of easier with boys because they just run out into the yard and take a leak, which is convenient. And I mean, it's easy for little girls to do that too, except it's a little bit more messy. But I encourage that. as much as possible until they figure out that you can hold it a little bit and then run into the bathroom and use that. And eventually, the big step is, can they not wear a diaper when they go to sleep or napping? And the moment that they're able to wake up and go use the restroom, that's usually about 2 years, 2.5 years, where they can get up in the middle of the night, rush to the bathroom, and use the potty or the toilet, and then they're not wetting the bed. So it's kind of you can imagine, if you think about it, it's a mental thing. It's also you have to build muscles in your groin. All of the inguinal muscles have to be able to hold the bladder and have to be able to, rationally, logistically figure out, okay, feels like it's coming in about 20 seconds. Where should I go? There's a lot of calculus actually going on with using the bathroom. So you see that kind of start to work itself out at about 2 years, which is a milestone. They begin learning how to really express themselves with simplistic words, but they're very honest or they're very direct with the words that they're using. They will learn basic single and two-syllable words very well. They learn language syntax, and they learn our regular kind of parlance. So they learn your parents' shorthand, the things that we say and the way that we will say a thing might be different than another family. But they will learn and get intimate with your own family's way of speaking, which is always fun because you hear them saying something that you've said a million times and you go, wow, they're totally mimicking. But I get it. I see what you're saying. They're not really able to completely express and make up words and put them together clearly, but they know enough to be able to piece together other things and other words and other body language to communicate enough through you. What's that mean to us? Well, then you can sit down with the toddler or the preschooler, and once you can get them to speak and communicate with you, maybe you have a parent there, you can talk them through what happened. How did you fall down? What did you hit first? Did you get knocked out? And you can start to put together a story that allows you to do a better assessment on these kids. So recognize that at this point, you start to be able to ask them not only like what happened, how and what did you hit first and so forth, but where are you? Do you know who this parent is? Who are they? And you can get a basic alert and orientation for them. You can ask them about their pain level. What's it feel like to them? Does it feel like a burning or a knife or a throbbing or sore? They will be able to answer those things if you can get into their own dialect and be able to communicate with them. Okay, and so that kind of ends at about the end of kindergarten is really the preschooler age, even though it's not preschool. Kindergarten. Once you get to first grade, second grade, third grade, up till about seventh grade, we'll say sixth grade, we call that school age children. Beginning at this age, they can very easily negotiate the world. They're good physically. They're very eloquent when it comes to speaking. They are able to communicate with strangers very well. Most kids, or they have the capacity to do that. Physical traits and functions continue to mature, and it's that exponential rate. So growth about 4 pounds and 2.5 inches each year. So we keep track of that at the doctor's office, and sometimes you got a little marker and you mark on the threshold of the door frame, and you kind of see how fast these kids grow. And you'll notice there's other things that we need to pay attention to. If you ask parents, it's like, do you notice they're eating a lot more now, or they've stopped eating? Whenever kids get sick or they're about to go through growth spurts, their consumption rates really noticeably change. So those are things that we need to keep in mind. And so usually at this rate of about 4 pounds and 2.5 inches a year, They're eating 3 square meals and probably snacking, and that's good because they're taking in a ton of calories, not only to grow, but also to compute what's going on. As I mentioned, the brain is using up usually about 20% of your body's calories, your energy. The permanent teeth, the old teeth, get knocked out and fall out, and they begin to get their own permanent teeth. We're getting not just brain activity increasing in both hemispheres, but integration of both hemispheres. This is when kids will decide right-handed, left-handed, ambidextrous, what are they going to be? Usually it's right or left-handed. And that's because they've worked out the micro decisions and the abilities, and they will then kind of adopt one side versus another, which is pretty wild to think about. Kids will start lying at this age, realizing that that will be punishment. So they usually say the smarter children tend to lie more often because they can look further into the future, figure out what's going to be beneficial for them, what would end up being detrimental, and they will kind of adjust the truth in order to benefit them in the future. So that does take a little bit of, as conniving as it is, it's actually pretty intelligent way of thinking at this age. There's actually a really interesting school of thought or contention between what are we inherently? Are we a selfish animal or are we an altruistic animal? What has allowed us to exist this long and benefit in nature? And is it our own selfishness that allows that? Or is it the altruistic tendencies of man to share? And they've kind of worked out, you would imagine the same thing, I think. It's both. In a certain situation, it's beneficial to be selfish, and in others, it's beneficial to be altruistic, to share with one another. So, and there's actually a number, I think it's like between after 3 or 4 people, altruism becomes beneficial. Between 1 and 3, you need to be selfish. It's like every human for themselves until the culmination of those 4 or 5 or more people could overall benefit the majority of them. That's the mindset there. Makes sense for us because we're working in crews of about 4 or 5. And as I've mentioned, sometimes 3 of you are stumped and have no idea on how to fix the problem. And the 4th person says, oh, this happened to my brother, and this is what we do. And that person solves the problem for the other 3. So it's important to be able to both work on your own, make sure you're taking care of yourself and your own safety, which is why our number 1 priority is your own safety. And next, it's be able to operate well in a group of functioning, intelligent human beings. And if you can do both of those things at the right times, mankind is going to continue to improve and advance until AI takes us all down and we're dead within about 3 million nanoseconds. And that's happening. When's the singularity supposed to be? 2032? It'll probably be before that. Any case. So conventional reasoning, kids are looking for approval. This is a very important thing, is to teach kids to get a dopamine or a serotonin boost when they do things correctly. You praise them so that they reinforce that behavior and they continue to do positive behavior and problem solving and reasoning, and you make that important to them. It's what I'm trying to do with you, is like make this fun and interesting so that you want more of it. So that makes sense. And they're kind of looking at their own benefit, looking for approval from peers, also making decisions guided by their conscience. That's wrong. Even though I might be able to get that cookie, I feel like that might not be, I shouldn't lie to people because then they don't trust me. So there's also that mindset that has to be engaged and starts to develop at this point. And along with that, because you're necessarily interacting with a crew, with other people, you start to develop some sense of self within that group. So you know who you are in comparison to your friends. And based on your success of communication, your success of gaining attention, you begin to develop some sense of a self-esteem. And that's very important because at the end of that period, you jump into adolescence. So we want to take a quick break here and we'll get back to this in a minute.
Sounds good.
Yeah, great. Okay. Wait a minute. I got to go back. Wanted to show you a couple things here. So let's do, I think, share screen, right? Share. Yep. All right. Are you seeing all of this stuff moving around, I guess, right? Like my pointer and everything, right? Okay. Can you see this girl here?
Yes.
Yeah.
All right. Just to give you an idea, I think I've shown this to a lot of my classes. It blows my mind, but it's crazy. It doesn't look like that, and because we're so used to looking at toddlers that you don't realize just how giant their heads are in proportion to their bodies. So that will come into play when we start managing kids. Let me go back to this part here. Hang on. Where are you? Ah. Zoom it. There we are. Nope. Now I can't even find. This is so frustrating. Can you all hear me?
Yes.
All right. Okay. All right. So, oh, here we go. Is that it? Like, I don't even know how to stop sharing my screen right now, and I wanted to talk to you. Okay. How about this? Can you see the middle adults and all that stuff right now?
Yes.
All right, good. So what I was going to say is the size of the head. Sorry, I can't show you, but I'll mimic it after I stop screen sharing. Size of the head really changes the way we have to position the rest of the body. I know you remember this from EMR, but you need to pad behind the shoulders to keep the airway open in kids. When kids fall, just the immensity of their head makes them fall head first. It's like throwing a lawn dart. And so oftentimes they smack their head. It doesn't always mean that they're going to have a life-threatening emergency, but the further they fall, the more likely that is they're falling. The gravity will be such that it positions their head first as they dive in and hit their heads. So what's that mean? Well, you have crown injuries, coronal injuries to the top of the head, and then that all transfers down the neck and back. So that can be a big issue. The thing that kids have going for them is that their skeletal system up until about 12 years old is largely cartilage. I don't know if you knew that, but you're mostly cartilage in your skeletal system. As you get older, you calcify. The calcium that you take in is then being deposited into the bones, and it's hardening your bones and making them actually osteocytes rather than cartilage. So this is why they always say milk has calcium for strong bones, because you're drinking the calcium, you're taking the calcium, and it's literally, the term is called calcification. You're hardening up your bone density by taking in more calcium. And we use an immense amount of calcium for the first 20 years of our lives, and then it kind of goes away. We'll talk about calcium later, but it's wild how important it is. It's not just for bones, it regulates the heart rate, the strength of the heart contractions. all sorts of crazy stuff. Okay, so we were at the age of preschool and school age, and this is just when kids can really talk to you, explain what's going on in their minds. They're reading. There's like the young adult books that are out, and they're really able to develop complex imaginations. Oftentimes they're out creatively doing really interesting artwork and writing stories. And in terms of physicality, they are able to participate in complex group sports, things like not, baseball and basketball. There's a lot of rules that entail in that game that you have to be able to compute in real time. And you have to be able to cooperate with others your age in a fair manner in order to accomplish, one or many goals, which is essentially winning. Those are huge, high, complex ordering systems that we are able to do at that age, and it's wild. And so you also see that in terms of groups coming together, socializing. That whole self-image and self-esteem situation starts to become more and more complex. Really interestingly, at about 5 years old, you laugh somewhere around 200 to 500 times a day. And that is the highest peak of laughter and the serotonin that you are gushing out in your entire life. It's usually at about 5 or 6, and you kind of taper down. But the immediate elation, the ebullient joy, kind of becomes more of a long-term sustained happiness. And that's what you see in terms of like a complex organization and an organism is like, okay, I'm not always laughing and then crying, but I'm able to set my lifestyle up in such a way where I'm happy throughout most of the day. I'm hanging out with people that I'm happy hanging out with and that get me and accept me, and I'm good. And I think this is going to be a pretty fun life. And then puberty starts. And then you get dosed with all of these oceans of hormones, and your body starts going through immense physiological changes. And suddenly, all of that lifestyle and friendships that you have worked out, luckily, you worked out a lot of it and you've developed it. Now you're introducing chemicals to this system, and you're creating new attractions and information circuits that are drawing in other people, other creatures, other genders. And you're starting to realize why, even though you think that girl's gross, you like them. Like, what's happening? What's happening? There's a weird testosterone thing that starts that makes men want to run and do reckless stuff and like beat up on each other. And it's a good energy. It's a good feeling. There's some other situations where that makes no sense to people. And then so you're segregating yourself off according to your own dump of hormones, your own tides of estrogen, testosterone, and all these other, all these chemicals that are running through your system. This is a real huge change in a female. And we're going to be talking, about, I know in terms of woke and everything, we're going to just keep this on the scientific tip this whole time. So I'm using male and female in the genetic sense throughout all this. With females, you notice a total change in emotional understanding of the world. And they notice that the anxiety levels in females exponentially increases in comparison to males. And why is that? Why would that happen? And one of the big thoughts is, well, now they are now ovulating. They now have the ability to create offspring. And genetically, evolutionarily, now these young girls have to consider, I'm going to have a kid potentially with somebody here. That is way too much responsibility for me to deal with. but I have to be thinking in terms of 3D chess. Who's this person? And it's not like you're going to go and get married and do this, but your body, I mean, 120,000 years ago, when mankind began doing this, these were the rules, and that was how things were set up. And so they're looking at these females, have to consider who these people are that they're around, if they're going to be essentially beneficial for their survival and their child's survival. And how do we then manipulate this world? Or how do I get the hell away from them? Because I don't want to have any of that to do with that. So there's a lot more going on than just, hey, you want to see me run fast? Which is kind of, what happens usually in an XY is that you're trying to really hyper develop gameplay and physical ability and real-time computations in high stress situations. Okay, so that's really what you start to see at this age. Junior high, God, the cliques and the niches of all of these things get super crazy. You see all of these alienating of kids, and there's, huge levels of self-esteem issues. And it's really because the complexity has exponentially fluctuated to the point where now you have the normal relationships you had as kids, except now there's so many more pieces at play in this situation. And your bodies are growing. You start to become really awkward and weird, and your face begins to mutate. It changes the way you're looking at yourself, to say the least. It changes the way you view yourself in comparison to your friends and the rest of the world. So this is about the time in just the basic vital signs situation where we level off and your blood pressure has increased about to the level that it will stay at throughout your adolescence and adulthood and really towards the end of your life. We have the regular ranges of about systolic around 90 to 120, and the diastolic somewhere between 40 to 90. Your pulse rate, this is your normal pulse rate, resting pulse rate between 60 to 100 beats. Respirations, 12 to 20. So we've kind of leveled off. And we'll get into all of those things and what they mean later, but it doesn't necessarily mean you have to have a heartbeat of 60 to 100 to be healthy. And it doesn't mean that somebody with a heartbeat within that range is healthy. So you can see there are ways to change these things around. But in terms of how we gauge pediatric vital signs, we should, by the age of 12, be able to use our normal rates and rhythms to figure it out. One way that you can do it in toddlers and preschoolers is you take the number 70 to get the systolic number, to get the high number on the blood pressure. You take the number 70 and you add twice the age of that child. So it's 70 plus twice the age, or 2x or 2a, if you want to do it that way. So if a kid is 6 years old, twice 6 is 12. You would add 12 to 70 and get 82. And that should be that 6-year-old's normal upper blood pressure number, somewhere around there. It's not perfect, but that's the way it works. And so we're checking, well, if it's really low, why would it be much lower than that? Are they dehydrated? Something of that sort. So that's a good way of running through that. Okay. So there's a big giant growth spurt. Usually XX go through it faster than boys or start earlier. Finish by 16 to 18 years. This is also when you see that menses begins. And at first, it's very sporadic. Sometimes there's a double ovulation. Sometimes it goes several months without ovulating. But around 18, that begins to regulate. And typically the way that menses or ovulation works, it's Every other month, one side will ovulate. So it's like the right ovaries ovulate or release an egg. The next month, it'll be the left side. It's not always the case. In the case of, let's say, fraternal twins, typically that is both right and left ovaries releasing an egg and both being fertilized. And so you're getting two separate ovums and two separate sperm. And you do have twins, but they're of different genetic material. That's one way of having it. But in any case, that's something that you start to see beginning around 16 to 18. Things start to level off and go at the normal rates and rhythms as adulthood up until menopause. Okay, let's see. There's secondary sexual development occurs. Breasts begin to bud, testicles distend. You get pubic hair, you get facial hair, you get different smells. You're giving off different pheromones. That is technically, if you are looking for the American Heart Association's definition of the change from pediatric to adult, it is that sign: breast bud development, armpit hair. And so what it essentially is saying is once that happens, now we're dealing with people on a different physiological level. Now things have ramped up and you have a whole different, not a whole different, but a much more complex set of vital signs of physiology between the organs and the systems and the drives versus a pediatric patient. So you see things like that. The secondary sexual organs begin to develop. Your vocal cords start to drop or extend, and your voice lowers if you're on testosterone. Menstruation begins. Acne occurs, and that's just really a fluctuation of all these different chemicals and things. And speaking of chemicals, not only do you have all these new things running through your system that your body's producing. By the way, does anyone know what the master gland is in the body that triggers puberty, and it sends a signal out to all the other organs? All right, time to start creating hormones. Boom, and it starts puberty. You know where that gland, what it is and where it is? Anybody?
Is it the pituitary gland?
Pituitary gland. Yep, it's in the brain. It's a little tiny pea-sized gland in the brain. They call it the master gland. And that's really the signaler of puberty. When that becomes active, it starts sending signals throughout the rest of the body to the other endocrine organs, the other glands, and they begin to go into production or overdrive. So very interesting. And by the way, there's people called pituitary giants, like Richard Keel, who played Jaws in the James Bond movies and Happy Gilmore. Who else could you think? Andre the Giant. They're called pituitary giants because they usually have an overactive pituitary gland at puberty, or they get a benign tumor on the pituitary gland and it just goes haywire and they overproduce in size, in hypertrophy, and the growth of like bones. So you see usually in those cases, they have like really pronounced foreheads and jaws. Oftentimes, like the joints are enlarged. There's another one called Marfan syndrome, which is kind of related to that they believe Abraham Lincoln had. So if you look at Abraham Lincoln, you can see these kind of really pronounced frontal foreheads and jaws and lanky, long bones with big joints, sometimes double jointed. That's usually some kind of irregularity at the pituitary gland or with the genetic composition of your connective tissue. So in any case, not only do you have all that crazy stuff going on, but kids start drinking, kids start using drugs, and start engaging in unresponsible behaviors, usually in the first time or first couple of years of doing it, irresponsible. But so we have to worry about not only that, but the overdose and the chemical toxicity situations. You also have to worry about the situational danger they get into because of drinking or drug use, driving. Of course, operating heavy machinery is not evolutionarily beneficial to humans when drinking alcohol. It's not part of us, right? So we're not built to take hits at 70 miles an hour. And you tend to see most car accidents are in most cases, there's alcohol involved, especially big, large, terrible car crashes. Usually alcohol is the culprit of that. Overwhelmingly, alcohol is the worst drug in our culture because of its ubiquity. It's everywhere. Nobody really thinks of it as something serious, and everybody partakes in it at some point, for the most part, at one time or another in their lives. And it's at the bottom of most crimes and most accidents. So, you can say what you want about heroin and meth. Comparatively, very few people use those drugs compared to alcohol. And the crime rate, yeah, of course, but just on such an abundant level, it's usually alcohol that's doing it. So, okay, so you're dealing with alcohol, you're dealing with drug use, you could have all the issues associated with the toxicity and the behavioral problems with that. Eating disorders are developing because of their self-image and issues with that. And eating disorders can cause malnutrition and can actually kill from that. So ideally, you have gotten a code of ethics or some kind of morality before you get into the drugs, hormones, crazy behavior, so that you can now begin to rein yourself in. And you use a code of ethics to develop that. It's kind of like, how much are you able to moderate, control your behavior, think about the future, and make responsible decisions. Some people can't handle it. You see at this point a surge in suicide and depression, really early adulthood early adolescence, mid adolescence up into early adulthood. There's kind of a shift, a high wave of suicidal tendency. And for some reason, there's a lot of conjecture about it, but for some reason, we're seeing a lot more of that within the last 5 to 10 years. Okay, so after that, adolescence leads to early adulthood, young Americans, this 19 to 40 years old, where you've now physically grown into yourself. You have leveled out, you have the normal vital signs and the physiology that you're going to have as you go forth for the next 30 years. Really, most people at this age are at their peak physical level, not mental level, but peak physical level. Your hormones are at their best. They're running correctly. They're at their highest that they're going to be. You are able to do most of the activities that we have for our benefit in society. This is when the military starts to pull people in and go, you're a young, healthy new man. We need that. Boom, the Peace Corps is pulling you in. This is when you start to make that decision for life. Doesn't mean you're going to go that way, but you are getting all of your facilities, your faculties together, and you're able to start pushing off on your own and getting out into the world and start navigating things entirely. Studies are showing it takes about 24 years for the frontal cortex to fully develop, for your rational brain to think intellectually. The cerebrum needs to be at about 22 to 24 years old. So what does that mean for us? Well, all of this other crazy erratic behavior and things that you're experiencing up until that point are kind of possibilities in terms of how you are going to wire your brain up to go forth and compute the rest of the world. Like, what are you building in terms of a conscience? What are you building in terms of a lifestyle, a discipline? What are your habits, your study habits? What are your bad habits? All of those things are in flux up until about 22 to 24 years old. And at that point, you start to reinforce the behaviors that you keep lingering around in your life. So what that means is if you haven't ironed out a lot of your trauma or issues, or you've been in a series of bad relationships, the tendency is, unless you actively take a step in the right direction and start to correct yourself, you're going to kind of fall back into those habits and lifestyles and relationships with people. It's very dangerous. And this is what you start to see in the early 20s. The certain issues begin to, if you will, calcify or become hardwired in and strengthened, because there isn't any active decision making to alter that to a for more beneficial way of behavior. Does that make sense? Hopefully that makes sense to you. So whoops. Let me go back to that. So the case is, unless you are taking an active position in your life, you kind of will fall into the habits that you've learned from the previous 22 years. And that can be good or that can be bad. This is why basically high school and college, your discipline, how active you are, how well you study, all those habits really are, you should be forming lasting strengths for the rest of your life, because the way you study for class for English Lit will be the way that you study for the promotion or the way that you work to get a job in a fire department. Like, those are your habits, and that all is going to ripple out from that point on. You can always change it. It just becomes harder and harder as the years progress. So as I mentioned, you're in a peak physical condition at this age, and you kind of your hormones begin to wane at about 30, about 25 for men and about 35 for women, or X, Y, and XX. So, like, as I mentioned, okay, good. So let's see. You start to center your life more on, instead of social structures, friends and things, you start to kind of narrow down your options towards your work, your family. You're creating a new family, and where you're going to go for the future. And that starts to bring on a different kind of stress, rather than the stress of physical exertion and the stress of so-and-so doesn't like me. This is the stress of, how am I going to afford the next 10 to 20 years? You're making these big, long decisions about things, and it creates kind of a long-term, or what some people call an existential stress. It's the stress of existing, of just being alive. You start looking at who you're going to, rather than going out and having, frivolous or fun encounters with people. You start to look for somebody more serious. Who would you like to marry? Who complements your behavior or challenges you in a good way? You're looking to become a little bit more stable, more or less. And I know this is not the same for everybody, but this starts to happen in a wide level on the bell curve at about 19 to 25 years old. Some people it takes to 35, some people 45. In Santa Barbara, where I went to college, it's about 45. People start to bear down and try and figure out which direction they're going to actually go. I'm lucky I got out of there in time. But in any case, this is that period of time where finances become a concern. And now that stays until we reach this attractive gentleman's age, the middle adult years. So we ideally have, in the last score, we go from being out of college to narrowing down some kind of job that produces some lucrative financial output. and it's a lifestyle that you agree with. If not, you've had the ability to bounce around a little bit, and but you're narrowing down your focus, or you're honing your skills to be able to go forward in life. At about 40 to 60 years, this is what we would consider the midlife crisis age. So physiologically, same vital signs, health wise, body's in pretty good shape up to this point. Your body is still clean, healthy, running well. You've been able to go out and drink, and you can rejuvenate pretty quickly. But once you hit 40, all of those things that you've done, those lifestyles that you started and you held on to from early adulthood up until now, will start to take their toll on you. So I think George Orwell, or maybe it was F. Scott Fitzgerald, he said, up until 40, your parents are responsible for your looks. From 40 years on, you're responsible for your looks, meaning all the stuff you did to yourself up until 40 years old, you start to see it showing on your face and your body. You get all of the cracks and the smoke and the cigarette, crow's feet, and you start to have the paunch and everything. And it's because you haven't been taking care of yourself. And so this is when you start to see malfunctioning parts of the body. This age group, 40 to 60 years old, is when you start to see deterioration of the circulatory system. You start to see differences in vision and hearing. They say at about 41, everybody starts to need reading glasses. You start to ask, huh? What was that? You're hearing less. You're getting tinnitus or tinnitus. You see a slight increase in cancer at this period of time. And somewhere around the late 40s into the 50s, ovulation will cease. You go into what's called menopause if you're an ovulating human. Also, like the cholesterol, the things that you've been eating have now started to cake inside your arteries and your blood vessels, and it will in turn start causing cardiac issues. It will cause high blood pressure. It will cause breathing problems. If you've smoked up to this point, you start to see chronic obstructive pulmonary diseases, because all of the plaque and all of the creosote and the smoke and the tar are now filling up inside those delicate thin alveoli, and it's no longer allowing good diffusion of gases. You're retaining carbon dioxide, and you can't get the oxygen out from the atmosphere through all of that tarry stuff into your bloodstream. So you start to see these chronic issues begin in people in middle adulthood from 40s into 60s. Some people have done a terrible job with themselves, and they actually taper out and die at like in their 50s. Usually you see the 50s is kind of a proving ground for most people. The crescendo of cancer incidences occurs in the 50s. The issues of whether or not you're going to get chronic obstructive pulmonary disease or heart attacks, they will either manifest in the 50s, or you more or less will have another 20 years without any issue. And so that whole period of that end of middle adulthood, 51 to 61, that's when all of the long-term medical issues begin. And that is when we start getting our repeat customers. Those are the people that we go on, and they are going to chronically have bad issues. Lifestyles have created chronic emergency situations. We're going on the cases, they're smoking and they have lung disease, bad lifestyle choices. That all also works into like, well, what did they decide to do with their lives? Did they get a job that pays their medical bills? Did they get a job where they are taking care of themselves regularly? And if you're an irresponsible person with your life, you're also more or less going to be an irresponsible person with your health. So it's a very interesting fact that I've noticed, and you notice after you've worked in the field a long time. You drive down the street and you look around at the houses and you go, guess what house? I bet you 10 to 1, it's the house there with the weeds growing up and the cars on the lawn. And it's because that person is just not taking care of themselves, just like they're not taking care of them, in all senses of the word, their health, their life, and so forth. So they're not really responsible on their meds. Ironically, they have dogs, like they are keeping their dogs as healthy as they can. They keep them up to date on all their blood pressure medications for their dogs, just not for themselves. It's a very weird situation to see. And it's unfortunate. So the point is, though, you're going to start to see these problems manifest in people at this age. Diabetes is a really big issue that begins type 2 diabetes around this time, mid 40s or even early 40s. And it continues if they don't manage it up until death. And diabetes is a monster. It will kill you in many different ways. Just the complications of having extra sugar in your system is horrendous to your body. Okay. What was that last bit? Exercise and healthy diet can diminish the effects of aging. And I mean, that's absolutely important. Some kind of exertion every day. They're seeing, what do they call that? Like a 0.1 benefit effect on people. It's like it moves the mark 1%, which is like a crazy result of just, let's say, having to walk around the block to the store rather than drive. And people that do that have a better longevity. Weird stuff. There's something called a blue zone. Has everybody heard of the blue zones? This was a study, I think, in the 50s or 60s, where they looked at who in the world lived the longest. And then they did a study on, well, why is it these areas and what is common among these areas? And it was like Okinawa. It was a place in, I want to say, Sicily, the Arctic. And they looked at all these groups and it was like, why is it? Well, there's it was high fish and vegetable intake, high social order. They had a social network and they kept their jobs longer. And then at some point it was that they had some kind of physical exertion built into their lifestyle. They lived in a hilly village, so they had to climb up and down hills all the time. So their bodies are still using the muscles. They're keeping their proprioception, their coordination. They're less likely to fall. And as they're working, all that toxin that is in your body is being flushed out because your heart rate increases. The blood excretes it into the kidneys and then into the liver, and you're getting that stuff out of you, and it keeps you healthier longer. So having a diet and having a good diet and exercise really can sustain life for a long, long time. I mean, in the blue zones, people were, I think the average age is 90 to 100 if you don't die from trauma. So it's markedly higher. We don't see that very often in America, especially in this area. You may see it some places like in rural towns and things. And again, I think this is where the future of our job is going to go, is into preventative care and how we can get people long-term maintained and living longer that way, rather than just giving a pill every time there's a problem. Okay, so at about 40 to 60, everybody good? Do we need to, you want to take another break and then we'll finish up in about 10 minutes? What do you think?
Oh, what about let's power through?
Yeah.
Power through? Okay, I'm not losing everybody. Everything's good. I feel like I'm blathering at this point.
We're good in the hood.
Ah, you're all good.
Hot dog.
5
Lock it
Cool,
up.
cool. Okay. All right. So middle adulthood. We got through the 40s. We're into the 50s. this is that shift. I said midlife crisis. You see another spike in suicide at this age. This is a crazy situation. It's like people realize, oh no, I've lived the entirety. I've been waiting to do this life, and I've lived it. And I've really limited my number of options, from maybe criminal acts that have limited any opportunity for me to get good jobs, or bad relationship choices, or whatever, trauma, whatever the situation has been. And many people, you see that they see this as the end stage. And so we see, like we did in late teens to early 20s, there's a spike in suicide. You see it again at this age. So 40s, about into the 50s, late 50s, along with the beginning of chronic illness and disease, you also will see a spike in suicide. And then it goes away. It's kind of like it's clearing the field, or people are just getting off at big stops. It's very odd to see this, and to see how these statistics work out, especially when you start finding yourself in these statistics and your friends. Very real, very, very visceral, and life affirming, I guess. Okay, so at this point, hopefully you have kind of narrowed down what you're going to do, and you can really go after it aggressively. Find out what you love and just start crushing. That's what you got to do, right? At this point, it's like, oh, I don't know what, something in this field, but I'm going to just go at it early and often until something starts popping that I like, and then go that direction. And that's it. It's like, find the thing that gives you the most energy back, the thing that you don't mind doing, even though you fail at it regularly, but you love it and you keep going back to it. Some people think it's weird, or it's not entertaining, or it's not fun, or it's gross, like pimple popping, but some people really like it. So maybe you should get into skincare. I don't know. I think of this stuff all the time. So find that thing and start narrowing in on it, and start to find your own space within it. You're going to hear my kid screaming at the top of his lung in the other room. All right. And in any case, this is really what the end stage of middle adulthood is for, is to basically start finding that thing that's going to give you not just life happiness, also some kind of financial security, so that you can live into your retirement and have money, or even if you don't retire, you have enough money to manage your own health. And in the case of you as a parent, you can start providing for your children's long-term either schooling, or their medical health, or kind of be a touchstone for them and a good example. So you should, at this age, ideally possess some physical, emotional, and spiritual abilities, and be able to handle your own life's issues. Because if you're a parent, you don't have time to manage your own issues. It is about your kids. If you are, in my opinion, a good parent, you have to be able to put your own self aside and be okay with that, and then focus on getting them squared away. So that requires, being able to think long term and to make financial and psychological decisions that are going to be beneficial for everybody, your kids especially. Maybe then they leave the nest. You have that empty nest syndrome where kids go off to college, and you can now once again focus on your own self and kind of go after some passions, but you still have the finances and the wherewithal to manage both of those things responsibly. And now you start getting into older adulthood. If you're lucky enough to make it to this age, you've gotten through the ringer, the Burma road of cancers, high blood pressures, atherosclerosis, stroke, all of that stuff. Hopefully you've weathered that storm and you're in fairly good shape. People start to fall off if you're not, and you're going to start kind of, that will then either you make it through there or those diseases intensify and then begin to slowly eat away at your health. So the bad heart disease, the atherosclerosis, then causes a heart attack, and a portion of your heart dies. And now you're living with an eighth of your heart not working. Well, that's eventually going to cause buildup of fluid into your body. It's going to cause buildup of bacteria and issues with breathing. And suddenly you start seeing these chronically ill people just worsening over weeks to years to then eventually months and weeks, and they kind of taper off and die because of these lingering illnesses and disease that they began to get in their late adulthood. Fortunately, we are, well, I think in our society, we're very medicine crazy. We're very quick, easy fix. And that's been able to keep us going. We do have the wherewithal. We have the information to eat well, to exercise right. And there is a growing number of people doing that, despite the fact that life is getting easier. Some people are choosing to work a little bit harder to get the things that they need and to get the reward for living a little bit more hardier. And that's allowing us, with that together with modern medicine, certainly with modern medical surgical practices, to live well beyond 78. And right now, even though that's the approximate age, usually we're seeing people get into their 80s if they've lived responsible, healthy lives up until that point. Metabolism begins to slow down. That means that people stop eating as much. It means that they don't have to have these big meals anymore. Health issues can take hold, but also if you maintain your health, you can kind of coast down through the rest of that time. I was going to say something and it slipped out of my head. So in this case, you want to make sure that these people are now kind of maintaining themselves in a healthy way. This is supposed to represent your what do you call it? Your stasis. How stable are you in your life? So when you're dealing with your health at an early age, you can do a lot of crazy behavior. You can be very irrational. As you get older, all of those systems don't have a resiliency built into them. And so you start to walk a tightrope of health. And so now drinking can cause a whole litany of issues. You could fall, you could split your head, you could bleed out, you could cause switches in your hormonal behavior that's going to throw you off for days to weeks. And, before you'd be able to go out and party one night and then come back and you're ready to go and go back to work. Just your body doesn't have the rebound abilities that it used to 40 or 50 or 60 years ago. So in that case, that's why we start to see these people falling off with their auto regulation. Cardiac output decreases, heart rate decreases. The veins, the vasculature becomes brittle. And so when somebody would fall as a kid, you would knock your head and all of the blood vessels just flex and bounce like rubber bands. When you get older, if you have cholesterol inside there or you've been taking medications like prednisones and steroids and blood thinners, all of those arteries become very brittle. And as you fall, rather than flex and bend, they tear. And so getting head bleeds is a very, very common issue with elderly. Head bleeds from minor falls causes a ton of deaths because it goes unnoticed and the bleed continues for days to sometimes a month. I just spoke with a family friend today, and he had fallen, and a month later, they found the head bleed. He had been bleeding precipitously for a month, and suddenly, all of a sudden, he's showing stroke-like symptoms. He can't speak. His daughter's freaking out. They call and they said, yeah, it was that fall you had a month ago, and they missed it. And that's another big concern here is you're seeing in medicine these days, because of all of these people living longer, healthier lives, there's a lot of patients, and these healthcare systems are being inundated and overwhelmed. And as a result, there are a lot of people being misdiagnosed, or things are not being diagnosed at all. And so we are seeing, as people live longer, a whole other concern with issues that shouldn't kill them, killing them off. Okay, just to take a look at the difference between healthy lungs and smokers' lungs. I don't think anybody smokes the way they did even in my time. Okay, so your area begins to decrease, and it's full of goop and bad stuff. And like the blood vessels, elasticity of all of this connective tissue begins to become more brittle. You have to breathe harder. Your muscles, meanwhile, the circulatory system, the muscles of circulation begin to atrophy. All your muscles begin to fall apart. And because of that, it becomes harder and harder to walk and move in the world and to breathe even. And some of the big things that we see happening, aside from breathing issues, are things like pneumonia. You're just not moving the fluids out of your lungs. And because of that, when it builds up and it stagnates, it becomes infected. So what they usually call pneumonia in bedridden patients is the old man's friend, because you go into the bed, you lay down, you're not very active. Maybe you've broken a hip or a leg because of some fall, and your bones are brittle. And now that fluid begins to build in your lungs, and you eventually cause a systemic infection. You become septic and you die from that. Can you all hear the craziness going on back here? That's a toddler. And he's losing his mind. This is bedtime. He's not happy. And that's not normal. That's bad. I'm an irresponsible parent. I shouldn't put up with that. Anyway, okay. What can also happen are things like strokes can cause literal issues with that sucking reflex that you had as a child. That sucking reflex is very similar to the swallow and gag reflex. And sometimes when the patient has a serious stroke, they lose the ability to swallow and they lose the ability to gag. And so what happens is the patients will aspirate, they'll inhale fluid and food, and that causes a massive infection and kills patients off. So lung issues are relatively quick and painless, but can kill people off very quickly. We see a huge incidence and increase in type 2 diabetes. We'll get into what the difference of type 1 and type 2 is later. But essentially, type 2 diabetes is dietary. It's usually brought on by the person eating poorly. So there's going to be some genetic predisposition. But type 2 diabetics are usually due to lifestyle and diet choices. Okay. GI, everything kind of slows down. Saliva decreases. And as I mentioned, you stop eating very well. All of these issues, what is it showing you? It's showing you that as not just the cardiovascular system stops being optimal, but your renal system, your kidneys, which filter the blood constantly, don't work well. Everything just starts to go into minor failure. And as a result of that, your entire system is less sturdy. So kidney failure is common. We'll talk about renal failure and dialysis, which, by the way, diabetes is a major contributor to. And then you have all these other issues with the neural system. You get a loss in the elasticity, in the fat buildup. There's a lot of fat around the neurons. And as you get older, that fat begins to disappear and your brain literally shrinks. So you can see that it causes big atrophy, meaning things start to stop. Atrophy means like they're dying off or weakening or becoming less and less. Here's an image of a bleed, someone having a trauma to the head because of, think about it, when your brain, you're more likely to bleed out if you have brittle blood vessels, if you're on blood thinners, which most people this age are on, if you drink, and a lot of people at this age, if they don't have a family or they've lost a loved one, oftentimes they will show increasing alcohol intake. This also is the period of time where you see the last surge in suicide. In older adults, typically widows and widowers, new widowers and widows, you see a major uptake in suicides. And this time it is not a call for help. It is, I want out of here. So a lot of gunshot, a lot of shootings, stuff that's permanent. So it's kind of sad, but that's the way this goes. The big goal here we go, is stay active. Watch out. Because what can happen is if you're not moving around, your bones become porous. And anytime you fall, you can get hip fractures, leg fractures. That's a death sentence. You can trip and fall on stairs and fall upstairs. Who knew? And you can, when you break a leg, you're bedridden. As an old person, you're not getting out of bed. And when you're not getting out of bed and your body is falling apart, you're going to slowly atrophy. And that will mean, well, I never get out of bed again. And when that happens, well, now you're filling up the lungs with a bunch of putrescent, bacteria-ridden guck, and that becomes pneumonia, and it kills people off. So what we usually see in these situations is they'll say that hip fractures, they're a death sentence. Well, why is that? Well, they could fix it, and they go in for surgery, and they do it because once you have the hip fracture, then you cause that person to become less active. And now that they're less active, take it easy. Because they're less active, they begin to atrophy more. And more things begin to affect them. And you become less healthy as this goes on. Stop sharing. Can you see me now? Did I fix it?
Yep, we see him.
Okay, great. So they always say keep moving. That's a good, keep moving, stay active. You stay healthier longer. The way I look at it now, after having a lot of medical issues, you got to keep moving because the ones that are slow are picked off easier. That's how nature works. We look at the deer that's got the broken leg, and all of the coyotes go after that one. And that's the thing. Once you start getting chronic illnesses, other illnesses glom onto you and it slows you down further. And eventually you get dragged down by chronic disease. So you got to shake that stuff off and you got to stay healthy, keep moving. And as much as you can, stay off of the meds, let your body build its own immunities and fix itself. That's my 2 cents in the whole story. And that's the case. So with that rationale, get moving, stay healthy, and get up off your butts right now and move around for the rest of the night. That's all I got for you this evening. Thanks for putting up with doing this at home and this screaming and shouting going on in the other room. I'll see you on Thursday. I will be in there full time. If you have any questions, I'll hang around.
Thank you, Ken.
Thank you.
Welcome, gang. Cool.
Ken, question for you. I
Yeah.
didn't actually see a schedule on the Canvas. I noticed that you had a PDF pulled up last time we were in the classroom.
Okay.
Could you post that or send it
Yes,
out in
I
an
will.
email?
I absolutely will do that. Hey, bud.
Thank you.
Okay.
Oh,
Do you guys see this guy?
yeah, I
Sure.
see
Okay.
part of his head.
All right. This is a preschooler. Say hi, Leo. You see yourself? There you go.
Hi. Oh,
That's a toddler. This is a preschooler. Notice he knows who he is. He knows he's on camera. He's a little bit shy. This savage over here. Okay. Very different. Okay. So very different. Okay. All right. Take it easy. You see yourself? Now there's a million people watching you, Asher. All right, so this is Leo, this Asher.
you and Asher.
They're all acting very, very appropriate for age. All right.
Say goodnight. Come on.
This is a thinker. This one is a savage running around getting in trouble all the time. Night, buddy. Love you. Oh, come in. Oh, come in. We're finished up here, so we're gonna finish up. So, they're gonna be in class. We're gonna be running scenarios with them, and you'll get a chance to kind of. I invite you to check vitals, find where these things are, and talk to them and kind of get an idea of like what is expected in terms of level of consciousness and vital signs and things. So, good night, guys. I'll be in a minute. So, in any case, if you also have kids, like this is how I'm going to roll from here on out. Like this whole family's getting in on the fun. All right. Any questions? Anything else other than that schedule of classes?
I have a quick question.
Okay.
Similarly, is there a syllabus of just list of you mentioned briefly that you might rearrange when you were going to teach various chapters from where they are in the textbook. Is there a way we could see a schedule so we could keep on top of our reading and read the chapter before?
Absolutely.
Learn about?
Yeah, I think that was what Kat was saying too. So I will get that up for you right now and have a schedule of classes so that you know what I'm going to be talking about. Of course, that you should have that right now. So my apologies. It's been a hectic week, but I will get that up. I'm going to get it up. I'll put it up today. So I just have to change the dates around, and we'll probably follow the same schedule as we did last semester. And so I'll put that up on, if I can include it on the first page of Canvas, I will put it there, and then I'll give you that as well. I'll send an email out with the schedule of classes. So you have an idea of what we're doing. Okay.
Thank you.
All right, gang. Thanks very much again, and I'll talk to you on Thursday.
Thanks, Ken.
Thank you, Ken.
All right.
Thanks,
Bye,
Ken.
Ken.
Thank you.
Bye.
You're welcome. Thank you. Thank you.
Bye.
Bye. I don't even know how to turn this thing off. What is going on with this thing? Nope. What did I do? This is the dumbest thing I've ever done. Holy cow, that sucked. Okay. Oh my God.